welcome to my basement. So this is my site presentation on the company I work for, Woven Care. We are comprehensive pediatric ABA services, and my role is a registered behavioral technician. I hope to get my master's and become a board certified behavioral analyst. So this is like the best next step. So yeah. What is Woven Care? Woven Care is a pediatric ABA company. We focus in evidence-based care. We try and take we take a family-centered approach. So we do in-home visits where we come show families the therapies we're demonstrating in clinic. We also go in home. We also have clinic settings as well as community settings. Community settings would be like going to the grocery store or going to eat out at Chili's and like practicing ordering, talking to someone we don't know. Maybe our food comes out wrong. How do we deal with that? Just kind of like best training and setting up those skills for success. So that's what Woven Care is. Our why is to improve quality of life. Families that have a child that is level 2 or level 3 autism often experience challenges with communications, boundaries, those things. Some kids are nonverbal, so we're like teaching them how to use an automated device to speak for them or to communicate their needs. Individualized care. Every child's behavior plan looks vastly different from another. We may try a therapy that we did on one client and it will not work, or we'll try things that we've seen great success with. Um, Dignity, autonomy, consent, assent, excuse me. Anytime we have a client whose behavior may be disrobing, we're going to make sure that they have their privacy even in the behavior. We're going to make sure that we have family support for treatment, and then we also practice ethics in the sense of we're not incorrectly billing insurance, we are not putting children at risk. We really just want to take care of our clients as whole individuals and not just treating what we as neurotypical people would see as a disability. The clientele or the group of people that we serve are children with ASD, so autism spectrum disorder, developmental delays. We support children who are in early childhood all the way through adolescence, and then we also support friends who have communication challenges. Me personally, I see more children with developmental delays and ASD, and I see a lot of kiddos anywhere between 2 and 7. I don't work with a lot of adolescents currently, but I'm hoping that'll change. We believe that families matter. Families matter because families are our partners. We see their kids in the clinic for 8 hours a day while they're with their kids every day, all day. So they're able to inform us of new behaviors that have started. They're able to talk to us about things that they're having trouble with at home. We talk about even potty training, like, is that going well? Have you started? Your kid's 4, still wearing diapers. How can we help? So we focus and we treat our families as partners. We bring them in, we let them shadow sessions, we let them shadow appointments. We also do parent training that looks like on a every 8 to 12 week basis. Parents come in, they get to learn about the therapy that we're doing. They get to practice it with a BCBA and an RBT, and then we can give them the materials to go home and practice it. One thing we use for quite a few kids is a token board. Kids really like the idea of working to earn something with their behavioral skills. Excuse me. So we'll send them home with a custom token board. Some of my clients like dinosaurs, so they have dinosaur token boards. We've got butterfly token boards. We've got K-pop demon hunter token boards. So whatever it is that meets the child's need and meets their level of engagement, we set up with them, and then we send home with parents. We want to make sure that we're also treating kids in a culturally aware and responding to their cultural needs. So whether it's holidays they do or don't celebrate, or certain rituals that are practiced, we want to make sure we're honoring that. And when we partner with parents, we truly get to understand their background and why things are said or done in their home that we may not understand. We also believe that collaboration improves our outcomes with kids. when parents are kept in the dark or don't feel like they're involved in care, they're wondering why are they making so much progress in the clinic and not making it at home. So in collaborating with families, we get to really help bolster that up, and we hope to help families grow and kind of just be able to function as one. So some of the say services that are provided is applied behavioral analysis therapy, which is ABA. We do behavior plans, future behavior plans, skill acquisition, parent training, and then all RBTs are required to get 5% of BCBA supervision to keep our license. My role as an RBT is one-on-one support, so I am directly working one-on-one with a child most of my day, at least 30 hours a week. I implement the behavior plans and the target goals that are set up by the BCBA. I collect data based off of how they did with the trial or how they're doing with a specific target. I collaborate with their team, so sometimes we're reaching out to their physical therapist or the occupational therapist and seeing how things are going. We're also reaching out to their BCBA if we're noticing problems or noticing no progress. We also uphold the highest ethical standard. So if our client is having a rough day, I personally choose just to let my BCBA know, hey, so and so is having a tough day. We didn't run that many trials. Just keeping their metrics honest instead of inflating numbers to please insurance or to make my numbers look better. I'll just tell them that we were having a tough day and maybe even ask for support if this is a continuing pattern when I'm working with that client. ABA interventions. So we do quite a few things in ABA that kind of look crazy to others if you aren't familiar with it. So we're going to start out with DTT, which is called discrete child training. It's how we can start introducing concepts to a client that may not have the skill. One thing that comes to mind right now is there's a client in my clinic. He does not really understand emotions very well. So we're teaching in a formal table, more like a tutoring almost vibe, private area of this is what happy looks like, this is what sad looks like, show me what mad is. And we're showing him those emotions so he can go into his his naturalistic teaching environment, and he can go, oh, that friend is crying, they're sad. He can identify the emotions in the natural world and not just as an emoji. We also believe in positive reinforcement. So that looks like verbal praise, earning tokens, tickles, squeezes, whatever reinforces the behavior. So some kids are really attention motivated. So if I say, hey, show me blue, they point to my blue jacket or they point to a blue square. I'm like, yay, let's go, you did so amazing. Some kids really enjoy that positive reinforcement. Some like earning something, they're really reinforced by, oh my gosh, you did such a great job, here's a token, we've got 2 more tokens, and then we earn iPad. Like they're really motivated to keep doing and keep moving and keep responding based off of how they're reinforced. We also believe in prompting and fading. So prompting would kind of look like me saying, hey, what color is this? They might not respond. I'll say, hey, what color is this? Red. Hey, what color is this? Red. Or prompting can look like, use your words. What can we say? Oh, you want me to open the door? Like that's prompting. Kind of like pushing for that answer to train them to like, this is what we have to do. Fading on the other side looks like I'm standing at the door. Maybe they don't need me to say, what can we say? How can we use our words? Maybe they don't need me to say that. Maybe they just need me to point at the door. That's a faded prompt. So me not needing to say, use your words, not saying, what can we say? But maybe me just pointing at the door, that will prompt them to be like, oh, hey, open the door. That is prompt fading. On the other hand, some kids will no longer need the point and they'll look at me, tap me and say, hey, can you open the door? And that's great. Like that's being completely independent, using your words, waiting for me to respond. That's great. We also use a function called task analysis. Task analysis is all of the steps. So if I'm teaching somebody to wash their hands, we're not going to say, hey, wash your hands. We're going to say, turn on the water. That's one step of this task. 2, get some soap. Step 3, put one hand in the water. Step 4, rub hands. Step 5, wait 30 seconds. Step 6, rinse hands. Step 7, grab a paper towel, Step 8, throw paper towel away, turn off lights, and walk out of the bathroom. That's a task analysis. So I'm assessing, where are we getting stuck? Maybe we have the first 3 steps of turning on the water, getting the soap and wetting our hand, but maybe we're like, I don't know what to do. That's when prompting comes in, and I can say, hey, now we've got our soap, let's rub hands. So maybe it looks like me modeling in the mirror, rubbing my hands together, or maybe it looks like me getting the soap. Or maybe it looks like my friend may be really stuck, and maybe it looks like me grabbing their hands and rubbing their hands for them, kind of giving them a full physical prompt. So I'm technically, yes, moving their hands, but they're getting the same experience. And they're learning the steps of washing hands. And that kind of transfers across the board. We have some friends that are learning on a task analysis for toileting procedures, from getting in the bathroom to sitting on the toilet to waiting to using the restroom to wiping those things. We have some friends that are on a task analysis for storytelling. Can you identify the beginning, middle, and end? So it just depends on what each client's needs are. Individualized care, I kind of explained that in the last slide, but we take a lot of data to determine their goals. The first couple weeks that a kid is in the clinic, we're really learning them. We're not forcing a lot. We're not pushing more than maybe using words or mandate, but data-driven goals. Over time, we adjust those goals based off of the data that we've gotten, and we're also teaching functional skills. So me kicking somebody to open the door is not functional. That's not using your words. So we're teaching them how to tap someone, how to tap their hand, how to point at the, oops, I turned on my flashlight. We're teaching them how to point, how to tap, and then we want them to generalize these skills. It's great if they can do it with me, but it shows that it's just me if they can't turn around and do it with a coworker. They can't turn around and do it with mom. They can't do it with dad. They can't do it with a teacher. So we want them to generalize the functional skills that they've learned. Ethics and ABA, this is really, really important. So I may take a minute on this. So we follow a strict ethics code set by the Behavioral Analyst Certification Board, the BACB. We focus on those ethics, whether it's client treatment, talks about inappropriate restraints, things of that nature. We follow that code of ethics. We focus on client dignity. So we don't ever want to put a client in a situation where they could be laughed at or made fun of. We want to really keep them safe and keep themselves protected. So earlier I gave the example, if we have a friend that like disrobes, we want to make sure that we're grabbing blocking pads and we're keeping them kind of contained in an area so that way other people walking by aren't watching. We also want to make sure that we're clearing the area if a friend is naked, or even if they're having a really hard time and having a tantrum. You want to keep that area clear just so that way they're not known as their peers as like the tantrum kid. Other staff members aren't getting the idea that this kid only tantrums when they do XYZ. Least restrictive methods. We focus a lot on not restraining children, not grabbing them. We want to use the least intrusive prompt level and go up. So even in the example of washing the hands, you want to say, okay, rub hands. A vocal prompt is the least intrusive. Second is modeling. I have not touched the client, or gesturing, as some would call it. I've not touched them. I'm just showing them rub hands. Next may be a partial physical prompt where you're taking their hands and you're like putting them together to prompt the rubbing. And then a full physical would be me taking the hands and rubbing the hands. But you want to use the least intrusive treatment method in a task analysis or in general. Even if you have a friend that's being dangerous, you don't want to automatically put them in a 3-point restraint. That's terrifying to the kid. It's stressful on the team. And it just doesn't show them that they're worth being respected. So you want to try and give as many opportunities. I can say in my year at Woven Care, I've never had to do a restraint, and we do as a company a little less than 20 a year, which is really, really, really great. And then we want to keep everything confidential. So if you noticed in this presentation, I haven't said any clients' names, I haven't given any ages. You just want to keep everything clear because at the end of the day, this is a medical record, and you want to be making sure you're treating it as such. Um, Legal and ethical in ABA, they do not go hand in hand. So what technically is against, what isn't against law, like restraints, doesn't mean it's ethical. Just because a client gets on your nerves doesn't mean you have the right to restrain them, or they're not listening to you the way you would like them to. You don't have the right to restrain them. Ethically, legally you can, and it's not against law, but it's dangerous for you, dangerous for your client. Insurance versus client need. We joke and say we're always playing a game with insurance, but this is true. Based off of each kid's insurance determines what we're able to do. Some kids that have TRICARE, we have a really tricky time getting them ready for potty training because TRICARE does not want us doing that. They don't think that's our role. They think that's the role of occupational therapy. However, that's ADL, a skill for daily life. So we try and create bathroom procedures to show toleration over time. But we're constantly bending what insurance needs to the needs of our kids. So, and it can't go the other way around. We can't please insurance for a payout. So we try and do what our clients need and focus on the backside of insurance later. Um, Advocacy and reflection. We spend a lot of time thinking about how well we served a client and how we could do better. Um, we want to make sure that we're treating our clients as people and not as problems or not as something that needs to be fixed. One thing we do focus on a lot is team-based leadership. So we follow a lot of collaborative models. We show open communication, and we have shared responsibilities. So clinic cleaning, shared responsibilities. Open communication, we're constantly saying, hey, I'm so sorry, we didn't get the chance to clean the sensory room. We'll come back. Hey, I need support here. That just creates really strong team narrative, and it also gives each person a chance to indirectly interact with the client. At my time at Woven Care, I have learned how to regulate my own emotions. I should probably be first. Ethical awareness, group communication, and commitment to human services. I thought for a very long time that I wanted to be a counselor and work with disenfranchised people. So my thought was like um, substance abuse, maybe people anxiety and depression, people who've been in prison. But I've learned that children with special needs are truly disenfranchised because a lot of people don't know how to deal with them. They don't know how to communicate with them. They take their lack of verbal communication as not being intelligent, and that is so far from the truth. Um, a lot of my nonverbal friends know a lot more about than me on a lot of things, including how to build things. So I don't see them that way. So that's one thing that has really committed me to wanting to work with special needs children and stay in the human services field. It has shown me that communication is not just the words that come out of my mouth, but it is the body language that we present. It's how we say things. Um, I used to sell wedding dresses, and I used to say, "Oh, I'm good, everything's fine." But somebody knows, like, especially my coworkers, they know if I'm like, "Oh yeah, that's great," they know that Jordan is actually really tired, starting to struggle, and they know that like I need support. And I've learned about my coworkers when they're fidgeting or irritable or leaning against something. I know that they're not feeling their best, and it comes time to step in and be a really great team player and support them. Ethical awareness, I didn't know how much could be manipulated by insurance until I started working in ABA. So I've just learned a lot about client ethics, and that at the end of the day, it's about the client that we're treating, it's not about their insurance. And then finally, emotional regulation. Um, you realize that you are not as patient or as stealth or as calm or anything when you're in this field. You really realize that you have triggers, things irritate you, whether it's a client not listening, having to redirect. You realize that you can get kind of emotionally dysregulated. And it doesn't mean you're flying off the handle screaming, but it can be, I'm really exhausted, therefore I'm just passively taking the day. So I've learned a lot about how to regulate my emotions, how to be back in tune with myself so I can be the best I can be for my client. And then in conclusion, my time at Woven Care has exposed me to the ethics of comprehensive care, and making sure that we're seeing the child for the child and not for their condition. Um, Child and family focused care is the most important because you don't want any member of the family feeling like they're less important. And then strong professional foundation. I feel like being an RBT has taught me so much about how to interact with parents, how to interact with higher leadership. And I think now that I've stepped into more of an intern role at my job and been shadowing a little bit more with the BCBAs, I've learned that professionalism is so important and it's past what you're wearing. A lot of the time we're in track pants and hoodies or um, hiking pants or khakis and a hoodie. Professionalism is more in how you say things, how prepared you are, and the growth that you're making than what you're wearing. So, yeah, I'd like to conclude by saying I've really appreciated my time at Woven Care, and this will be my intern site next semester. So I can't wait to share with you some more things that I learned. Thank you. Bye.